So in this video, we're going to look at mobilizing rib heads. They are posterior. So we have her in prone. And essentially with rib heads, oftentimes they can just get compressed on the attachment point of the thoracic spine. So our biggest intention with the rib head is to decompress so that we can do a relative posterior to anterior motion, and then we just have to figure out, do we combine the decompression posterior anterior with a superior intention or an inferior intention? Okay, so we're going to talk about how to find them first. So in order to find rib heads, we want to find spinous processes in the thoracic spine. And as we know, there is a rib that attaches to every segment of the thoracic spine. So if I just kind of generally come off of thoracic spine, right, then we have the gully here, right? And then after about a thumb's width, I come out to the side of that thumb, and then from there, that's where we're going to find the rib heads, okay, or where the ribs kind of attach onto the spine, right? So thoracic spine, about a finger width, and then right here we're on rib heads. And then also, just kind of a fun fact, if you're kind of just rolling over here, you'll feel like down in my bottom hand here, there's not really much tonality in the paravertebral muscles. But right here on my index fingers, you can probably even see that tonality there. And then if you follow that tonality up to the highest point, you can generally find a segment that is hypomobile or dysfunctional. And so there's a high chance that this segment here would need to be mobilized from a thoracic spine standpoint, but also just checking the rib head that attaches to that, okay? So let's say I'm here, I come one finger width over, and then I kind of feel what that soft tissue feels like, ooh, this area, there is some banding going on. If I sink through that tissue in this area, I can get on what feels like bone, because it is, and that's where the rib attaches. Okay, so I am specifically interested right here in this rib head. Okay, maybe it's like rib 3 or 4-ish range. All right, so now that I'm here, I know that I want to decompress it away from the thoracic spine. Now I want to check if I go up on an angle versus going down on an angle, which one is the harder infill? And for me, going up on that angle is a harder infill, okay? So how am I going to then mobilize it, right? So we have the decompression, relative PA, and then a superior mobilization here. Now, I could mobilize this through her arm across the table, right, which is not ideal from my body mechanics standpoint. So I'm actually going to come around. So if we bring the video to the opposite side of the table, there. So now I am going to do basically a pull technique where I am going decompression, P to A, and a superior motion all together as I wind up through her arm. Don't let me lift you up here. Very good. And let it go. Okay, I could also, if I wanted to kind of a little bit of a different body position, I could also come here, and don't let me move you there, mobilize through my thumb. Okay, I could also use, if I come onto the front of her shoulder, I could also just use her scapula or her shoulder girdle to mobilize through that rib head, and then hold there. Don't let me lift you up, and let it go. Okay, but in general, if I was doing a more superior direction of mobilization, that's kind of how I would do it. If I was doing a more inferior mobilization, I would try to do actually hand behind head, so that this way I can actually pull down and away as I mobilize her. Let me see if I can just find one real quick. Right there. So now I'd localize through her arm, see what brings tension into my finger, and now I'm pulling down and away. Don't let me lift up as I'm trying to get that rib head to decompress in that direction, Now, okay, so that is identifying a rib head restriction. Also, mobilizing a rib head restriction in a specific direction. And ultimately, the goal for so many of our clients with rib head dysfunction is their shoulder blade cannot sit well on the rib cage. So it's relatively, the rib cage is in the way, and we want to get it out of the way so that then shoulder blade can sit in a better position, and then the whole shoulder girdle is a bit more stable. That can manifest in shoulder pain, elbow pain, neck pain, okay, and even potentially below. All right, so assessment, treatment of rib heads and prone.